Me too.
Baby's first checkup. Oh, what did you expect at the appointment? Jessica, they're ready for you. Please head to the back. Hello, how are you doing today?
We're doing good, thanks.
That's good. All right. Let's take a seat. Here we go. Thanks for coming in today. I'm sorry to inform you, but your daughter has Nephropathic Cystinosis.
What is that?
Well, it's a rare kidney disease that begins in infancy, causing poor growth in kidney disease.
Doctor, what's the science in that?
The signs, you ask? Molecules that should be reabsorbed into the blood are eliminated in the urine. There's an accumulation of cystins crystals in the kidneys, which leads to organ damage. That's the science.
Our kidneys are located in the upper abdominal area against the back muscles on the both left and right side of the body.
The kidneys are part of the endocrine system and assist with the circulatory system. It helps filter the blood coming from the circulatory system and takes out any waste it finds and then uses it in the endocrine system to dispose of them.
Cystinosis is a condition characterized by the accumulation of amino acid cystin, and by having nephropathic cystinosis, the cystine crystals will be found in your nephrons and renal tubules of the kidneys. Excess amounts of cystine damages cells and forms crystals that build up and cause problems in organs and tissues. Kidneys are especially vulnerable to damage, making this disease very serious. It begins in infancy, causing poor growth due to the kidney problems that lead to loss of minerals, salts, and fluids. This disease throws off the balance of the body's salts, hormones, water balance, and etc.
Oh no, our baby Jessica.
So what are the symptoms?
The symptoms may include that Jessica might not grow normally. She might have excessive urination and dehydration. Craving of salt due to mineral loss could be another symptom. Swelling, sometimes swelling in the legs, and she might not produce as much sweat or tears as any other kid.
So what does this all mean?
Well, unfortunately, it means that she'll be having to come in for weekly doctor office visits, and she'll be getting dialysis, probably once or twice a week. And in the big picture, a kidney transplant is the way to go.
Families who have to deal with this disease realize that it is an everyday struggle. People diagnosed with this disease are constantly taking medication, still develop many problems even when on medication, and undergo frequent hospital visits. It is a very time-consuming disease, and the patients are in a constant struggle to live. Most patients by the age of 6 to 9 years old start therapy to cope with what is happening to their body. The patient is constantly taking medication, always needs to be under watch, they are unable to do most activities starting at a young age, and they constantly need to monitor what they eat and drink in order to maintain equilibrium throughout the body.
Hi, Dr. Reynolds.
Hi, Jessica, you grow up every week. I see you. How you doing today?
I'm good. How are you?
Oh, I'm good. You ready for your weekly dialysis?
Can't wait.
All right.
This disease is treated symptomatically, but some of the most common ways to treat it are with dialysis and eventually a kidney transplant. The downside to the kidney transplant is that there is a severe shortage of organ donors, and some patients have to wait quite a while until they can actually do the transplant. With this being a major negative effect on the disease, the mortality and morbidity of the disease is quite high.
All right, Jessica, you know the drill. We're just going to clean your fistula. Get ready for peritoneal dialysis. All right. So we're going to take your dialysis tubing and insert it into your lower abdominal through the fistula. This may take a couple hours. Hi, Jessica. How you doing today?
Not so good.
Oh no, what's wrong?
I'm really tired, really itchy, and I just can't pee.
You know, as you might know, those are some symptoms of kidney failure, but we'll check do some tests and see what's going on.
Okay, thanks,
Okay.
Dr.
Yeah.
Reynolds.
So we're gonna do some blood work and an ultrasound of your kidneys to see what's going on. So just lay back for me and we'll get that done real quick.
Okay.
So guys, we got your blood work back and looks like your disease is progressing. I think it's time to do a kidney transplant. We'll put you on the list and try and find a match for you.
When you need a kidney transplant, it will come from a close relative or friend who has the same type blood, tissue, and get an organ that is close to the same size as your original kidney. When it is time for your surgery, you will give a blood sample so that doctors can do antibody cross-match test. This is done to find out whether or not your immune system will accept the new kidney. In most cases, your old kidneys will be left in your body and won't be removed unless it is causing high blood pressure or an infection.
Oh
my God, I'm so sorry.
No.
So we'll put you on a waiting list. It might take a few months to find a match unless you know someone that has the same kind of kidney as you. Maybe a family member.
I have the same kidney as you.
Can I have your kidney, Mom?
Of course. Okay, awesome. Now that's out of the way. We'll schedule you in for a transplant.
With a kidney disease, we often see protein being secreted along with our urine. Proteins can be found in important immune substances such as enzymes and antibodies. A damaged kidney can also cause lots of toxins and waste to accumulate in the blood and be circulated everywhere in our body. Many of these toxins are harmful to our tissues and organs, which can have direct effect on our immune system. For example, bone marrow is a major organ in our immune system, and if toxins reach this organ, they can inhibit its function of producing cells. If the organ is dead, then it will not be able to maintain homeostasis throughout the body.
Thanks, Mom, for your kidney.
No problem. Anything for you, honey.
All right, guys, you ready? I'll show you to the room back here. We're going to put you under anesthetic so you won't feel anything and you'll be asleep. We're going to remove the kidney and then it's going to go into your daughter, okay?
Okay.
All right, lift your head for me. And count to 10. Here we go. All right, everybody. We removed the kidney. Now we need to put it in here and transport it to the other patient. Down to Jessica's exam room. Jessica is currently under anesthetic. We will be inserting this kidney into her. So the surgery went really well, but there are some complications that come along with kidney transplant. The most common complication is rejection of the kidney. Your body will think that the new tissue is foreign and try to protect it by attacking it. This is normal response to the surgery, and we will put you on anti-rejection medicine. Kidney rejection is hard to diagnose early, so you must take this medication no matter how good you're feeling, okay?
To keep your body from rejecting your new kidney, you will be kept under close watch and given medication. A person's immune system is programmed to sense foreign objects, such as germs, and help the body get rid of them. Unfortunately, your immune system will recognize a new kidney as a foreign object and will attempt to reject it. To keep this from happening, you'll need to take medicines called immunosuppressants. After a person receives a kidney transplant, they are most likely able to go into somewhat normal lifestyle, but they have to avoid some activities that may damage the new kidney.
I recommend that you set a digital alarm to remember to take your medication. It needs to become a part of your daily routine. Even if you feel like the transplanted kidney is working, you have to continue to take them.
Will my daughter Jessica have any side effects?
Yes, there are some common side effects, and they include high blood pressure, weight gain, an increase of getting infection, and an increased risk of getting some kinds of cancers.
Okay, thank you, Dr. Reynolds, for everything you've done.
Okay, Jessica, you need to continue to come in for checkups, okay? And keep taking your medicine.
Currently, there is no cure for this disease. There are treatments that seem to help with the side effects, but usually the medication that patients use seem to have even more side effects. Hematopoietic stem cell transplantation, which is a significant therapeutic benefit in the mouse model of cystinosis, could be the next treatment for cystinosis. However, cell therapy has the same benefits in patients as mice needs to be demonstrated.